If someone you love had a stroke, this video is for you. The first question families ask is, will they ever be the same again? The honest answer, sometimes yes, sometimes partially, but recovery is often far better than people expect. Let's understand how the brain heals. Many people believe once brain cells die, they are gone forever. Recovery is impossible. This belief is outdated. The brain cannot regrow large number of dead neurons, but it can reorganize itself and form new connection. And this is called neuroplasticity. And it changes everything about stroke recovery. So this video is about stroke recovery. Hello everybody, I'm Dr. PK from Dr. PK Life. The stroke occurs when blood flow to part of brain is interrupted. There are two main types. Ischemic stroke, most common, blood clot blocks an artery going to the brain. Hemorrhagic stroke, the bleeding inside the brain, the artery ruptures. When the brain cells lose oxygen, some cells die permanently. Surrounding cells become injured but may recover. The key factor is how quickly treatment is given. How the brain repairs itself. Even though the dead brain tissue does not regenerate fully, the brain has remarkable adaptive capacity. Neuroplasticity is about rewiring. Healthy areas of brain can form new synaptic connections, strengthen existing pathways, and take over lost function. For example, if the left motor cortex is damaged, nearby regions may compensate. There is an axonal sprouting. Remaining neurons can grow new branches called axons to reconnect with other cells. Functional reorganization. Other regions of the brain may assume roles they did not previously perform. That is why speech can partially recover, walking ability may improve, arm strength may return gradually. So what determines the recovery? The time of treatment. Faster treatment, less damage. Location of stroke. Brain stem strokes are more serious. Size of a stroke. Larger infarction, more disability. Age. Younger patients adapt better. Rehab intensity. Early therapy improves outcome. Early rehabilitation is critical. Rehabilitation stimulates neuroplasticity. This includes physical therapy, occupational therapy, speech therapy, and cognitive training. The brain responds to repetition and stimulation. The more you challenge it, the more it adapts. The timeline of recovery. First, 24 to 72 hours is the emergency phase. First 3 months, most rapid recovery. Up to 1 year or longer, there is a continued improvement possible. Recovery does not stop at 3 months, but early months are most dynamic. Most of the recovery happens within a year. Can medication help brain repair? Currently, no medication can fully regenerate dead brain tissue. However, medication can prevent another stroke, can control blood pressure, can manage cholesterol, reduce inflammation. Now, research is being done to explore stem cell therapy and regenerative drugs and brain stimulation techniques. It's quite promising, but still under investigation. Can 100% recovery happen? Sometimes, especially with the small strokes treated on time. However, many patients recover partially. Some retain mild weakness or speech changes. Every stroke is unique. And it also depends on the comorbid conditions of the person and what was their physical status and general conditioning of the body. So brain can partially repair itself. Neuroplasticity is the key mechanism. Early treatment saves brain tissues and intensive rehab dramatically improves recovery, and prevention is critical. So thank you for watching. I'm Dr. PK from Dr. PK Life.